So I will tell you a little bit on edema disease and the impact on the animal. You know, edema disease is one of these infections caused by E. coli in the post-weaning period. And in that period, several E. coli can infect the piglets. You have the enterotoxigenic E. coli and the Shiga toxin producing E. coli, which are also called virotoxigenic E. coli. So both names are used in practice and are equally well used or equally allowed. The enterotoxigenic E. coli, they produce enterotoxins, which you probably know. The LT is the thermolabile enterotoxin, and two thermostable enterotoxins, STA and STB. Whereas the Shiga toxin is produced by the Shiga toxin producing E. coli, which are only the F18 Fimbria positive E. coli. So you have two different Fimbrias that can be present in these E. coli strains at weaning. Fimbria are colonization factors. You have a 4 Fimbria and F18 Fimbria. And 4 Fimbria are only enterotoxin producing E. coli strains, and F18 Fimbria are present on enterotoxigenic E. coli producing strains or Shiga toxin producing strains. So the Shiga toxin producing strains can cause the disease that you know as edema disease. So when you isolate E. coli in the post-weaning period, then a number of virulence factors can be identified on these strains. And this slide gives you an idea of what you can find, but it can be even more complex. So you see in this study, which was occurred in piglets with post-weaning diarrhea, F4, LT, and STB is most prevalent. But that's of course normal because you're looking for strains that produce diarrhea. But some of these isolates produced F18 and Shiga toxin, of F18 and enterotoxin and Shiga toxin, or didn't have Fimbria and produced Shiga toxin and thermostable enterotoxin. So it can be quite complex, and this can be complex on farm level. So you can have many different virotypes on a farm, but even in piglets, when a colibacillary problem is there, you can even isolate 2 or 3 different virulence strains from one piglet. So this makes it extremely complicated. This is not always the case. Sometimes only 1 or 2 of these virotypes are present on farms, but on other farms it's a complex mixture of virotypes.